Good morning everyone. Today I'm going to discuss about how do we assess our patients in a life-threatening emergent condition. So if you go to a room and you see the patient is not responsive, is not awake, you need to check the pulse. And if the patient is not breathing, if there is no pulse, you need to call code blue and then start CPR. Do the CPR, and when the code blue team or whoever is coming, you can hand over a patient to them, and then you can be the primary nurse. That means you can explain the situation, what's going on, what medication that patient received. Just a brief explanation of situation you can give to the code blue team. That will help the doctors to identify what's going on. And also, and let's say the patient has pulse but the patient is not breathing. What do we do? Like, we need to maintain the airway, right? We need to do the first of all, let's look at them and then make sure there is no trauma is involved. Let's say they fell down and then they broke the cervical spine, or there is like blood or whatever. If there is no trauma involved, you can do what is it called, like the head tilt, chin tilt maneuver, which means basically you're opening up the airway, causing the tongue to be replaced so that they can breathe. And so if there is a trauma involved, you need to make sure you're holding the cervical spine in straight line. You don't want to mess with that. And also you can carefully open up the airway and then let them breathe. Okay, say if they started breathing, you can use the non-rebreather 100% oxygen mask, and then you can assess their breathing, like how are they breathing, the rate, depth of the respiration, their respiratory effort, how is their breath sounds, is there a trauma to the chest, is there a jugular venous distension or tracheal deviation occurred. And if, let's say, if they are not started breathing, then you can continue using the ambu bag or bag valve 100% oxygen and give supplemental oxygen to them until they start breathing. When you open the airway, you need to inspect for any obstruction. If there is any obstruction, you need to remove that. So maintaining the airway that can help them to get the proper treatment they need. Okay, let's say that they have an opened airway now. They are breathing fine. The third one, C, ABCDE. That means airway, breathing, circulation, disability, and exposure. C, circulation. So check for the pulse, of course. How do we assess circulation? We need to know the peripheral pulses, we need to know the heart rate, we need to know blood pressure, we need to know capillary refill, right? So to assess if there is any issues for perfusion. So if there is an issue of perfusion, then it can lead to shock. The main symptoms of shock is increased heart rate and decreased blood pressure. Tachycardic and hypertensive is the main signs and symptoms of shock. So we do not want our patients to go to shock. So what do? Just look at them, and if you see a bleeding, you need to stop it. Apply direct pressure and stop the bleeding. Infuse IV fluids, lactated ringers, and 0.9 sodium chloride, or blood products you can infuse. First of all, just start on both ACs. You need to start an IV, and of course we need to give them oxygen, and also in order to shunt the blood to the vital organs, you need to elevate the lower extremity as well. And also it's a very stressful situation. You need to reassure patient and their family, patient if they are conscious, and the family that everything is going to be all right, you're trying your best. And D, disability. So mainly we are assessing if they're conscious or not. You can use the AVPU mnemonic, which is like, if the A means alert, V means responsive to the voice, P means responsive to pain, and U means unresponsive. Also, we can use GCS, Glasgow Coma Scale, which means we are basically assessing eye opening, motor response, and verbal response. It's like 4, 5, 6. Let's say eye opening. If they're not opening their eyes, that means 1. If they're opening the eyes for your voice command, that means 2. If they're pain, that means 2. they're opening eyes for your voice command, that means 3, and then if they're opening eyes spontaneously, that is 4. And then the second one is verbal response, that means if they are not responding, that is none, means 1. If they are responding but we cannot comprehend what they're saying, that is 2. If they are responding but inappropriately, that is 3. If they are responsive but then they are like confused, that means 4. If they are oriented, that is 5. Okay, then the motor response comes in, that means like, okay, there is no response, that is none, but they can extend, they have some kind of extension, that is 2. They have flexion, that is 2. They withdraws, that is flexion, that is 3, and then they withdraws, that is 4. If they have localized pain, that is 5, and then if they obey the commands, that is 6. That's how GCS goes. 3 is very critically low, that means they're very unstable, and then the 15 is like, that's the maximum. As the score goes up, they are more normal. So but we need to monitor like frequently about their more neurological status, exposure. Say the patient traumatized, as well as they have some exposure to chemical or burn. So whatever as we are doing the resuscitative methods, we need to remove their clothing. We do not want to throw away the clothing and stuff, because we need to realize, or we need to find out what chemical or whatever that caused that trauma. But make sure we are giving them fluids, warmed fluids, warmed oxygen, because unwarmed fluids and oxygen can lead to hypothermia, because already the core temperature is very low, and then if it goes down goes down to less than 35 degrees Celsius, that is hypothermia, which leads to eventually they can lead to coma, hypoxia, and what else, shock, what else, acidosis. So to prevent that, we need to make sure we need to give them warm blankets, warm oxygen, warm fluids, remove wet clothing from them, and increase the temperature of the room, of course. And that's how I told you about the ABCDE. A airway, B breathing, C circulation, D disability, E exposure. And I hope this will help you. Thank you.